Hey everyone, so here we're going to review a few topics on musculoskeletal system. So first we have plantar fasciitis. What is plantar fasciitis? Which is a micro tear of the plantar fascia. So what is fascia? Fascia is the fibrous band on the bottom of the foot that connects the heel bone to each of the toes. Okay, as you can see in this picture, there is a tear. Okay, so heel bone to all of those toes, so there is a tear in between, and that's the reason when patient walk they have pain. So bottom of the foot, the pain that gets worse when they're walking, and especially early in the morning their pain is worse. What do you do? So in that case, you order x-ray, just to rule out like if they have any fracture going on or any bone spur going on, stuff like that. The main choice of treatment is give them NSAIDs. Excuse me, my throat is kind of itchy a little bit, but you can give them NSAIDs, refer them, to podiatry, and they can also do some stretching exercise that can help. Next one is Morton's neuroma. Morton's neuroma, which is inflammation of the their digital nerve of the foot, which is located in between third and fourth toes. Main sign and symptoms they have is the pebble-like nodule. Okay, that's the main sign and symptoms. The test you do is the Mulder test, where you squeeze their foot and they would have pain. That's called Mulder test positive. Okay, what is the choice of treatment? Here also you're gonna refer this patient to podiatry. The other sign and symptoms they're gonna have where pain that gets worse with walking. um, they would have plantar foot pain. Okay, Mulder test positive. Choice of treatment is you tell them, avoid narrow high shoes, use a 4-foot pad, well pair shoes, and also refer that patient to podiatry. Next one we have is ankylosing spondylitis. So what is happening here? This patient presents to you with chronic back pain that is like going on for more than 3 months. They have chronic back pain, worse in the upper back area. This one is chronic inflammatory disorder of the spine. When you order x-ray, it's gonna show as a bamboo spine, and that's the classic sign for ankylosing spondylitis. Their ESR is gonna be elevated, C-reactive protein is gonna be elevated because it's the bone issues, and then their rheumatoid factor, it's gonna be negative. So what do you do? So you refer this patient to rheumatologist. You also give them, NSAIDs and stuff like that. But the main, thing you do is give them NSAIDs and also give them PPI, because sometimes if they're high risk for ulcers and GI bleed and stuff like that, or they had ulcers in the past, yes, we want to make sure that you give them PPI with NSAIDs. Okay, the other thing they present with, it's kind of sometimes they have like blurry vision, photophobia, redness of the eye, um, watery discharge, stuff like that. They have those sign and symptoms, and the main reason for those sign and symptoms is because they have anterior uveitis. Okay, you can see this picture in the on the slide where they present with anterior uveitis, and that is one of the complication for ankylosing spondylitis.